Now, the White House says that federal health officials have been in close contact with state and local governments as they study and track this new variant.
Governor John Bel Edwards says people should take this time, now more than ever, to get vaccinated and get those booster shots. Joining us to talk about the spread of this Omicron variant and how this could impact us here is the Chief of Community and Population Medicine at LSU Health, Dr. Ben Springgate. Dr. Springgate, good to see you again.
Great to see you as well.
And Dr. Anthony Fauci says it's not a question if, but when it makes its way to the United States. So I guess just explain for us how this is different from the Delta variant and how worried people should be, even though they're saying not to panic.
Well, we know that this virus has some new mutations in it in different combinations than prior variants. That may mean that it can evade our immune system a little bit better than prior variants. And that's really what has a lot of the infectious disease experts worried. So we need to pay attention to that. And ultimately, we have to see how easily is it transmissible? Can it out-transmit or out-compete the Delta variant, which is the dominant strain worldwide right now?
Definitely. And what are we hearing about vaccines so far about this? I know there's still a lot of questions, but they're saying they don't know if the vaccines are able to protect against this specific variant.
Well, most experts believe that there will be some protection offered by vaccines. It may not be as strong as the current protection against the Delta variant and prior variants. So what's anticipated is if they determine in the next weeks that the current vaccines are not sufficiently strong enough to prevent transmission, to prevent severe disease, new boosters will come out, which will hopefully address this.
And speaking of that, when people hear that, should we wait for those new boosters to come out? Should we, if we're eligible to get a booster right now, should we go ahead and do that?
No, go ahead and get the boosters now. As of now, the information that we have shows that for the vaccine that is in our community today, for the virus that's in our community today, the vaccines work. They prevent serious illness, they limit hospitalization, they limit death. In the future, if we get further information, we'll all be able to take advantage of that to get additional boosters.
And do you recommend us mixing whatever vaccine we got with the booster? Like say I got the Pfizer, should I get the Moderna booster, or does it not matter?
Well, you know, there is some evidence that suggests that a mixing and matching approach can offer additional benefits, and some people may want to discuss that with their doctors. It has been approved now by federal authorities for people to do a mix and match strategy, but if you have started off with one approach, you're using Pfizer, you're using Moderna, it's okay to continue that as well.
Sure. And of course, the Biden administration has placed travel restrictions on some of those South African countries where this variant has been detected. Do you think that is enough at this point, or as some health officials have already said, listen, we already probably have cases in the U.S. that haven't been detected yet?
Chances are that the cases have already come, much as they've already been detected in other places around the globe. What the placing those travel restrictions does is potentially buys a couple of extra weeks to study the virus before a large number of cases moves through air transport to other countries. But chances are it's probably already here, and we just need to begin to prepare for it now, get our vaccinations, take the precautions that are necessary. If you're going to be spending time in large crowds among people that you don't know, potentially consider wearing a mask.
And Dr. Springgate, it seems like every time there's light at the end of the tunnel, a new variant comes about. Is this something we're always going to have to deal with?
Well, it's certainly possible that the virus may become endemic, which means it's something that, you know, has a seasonality and continues to spread throughout our communities year in and year out. But the things that we can do really are try to decrease that likelihood are increase our vaccination rates. We have a strong vaccination rate here in the New Orleans area. We want to try to improve that even further, but also try to get vaccines to other countries and other areas of the world where vaccination has not taken hold yet, where there haven't been as much of an opportunity to get vaccinated, so that we can decrease the likelihood of a new variant developing with every next infection.
Sure, and there's still so much to learn about this variant. We were just saying that South African countries are saying they're seeing this more right now in young people, and they're not sure if it's causing more severe illness.
That's right. We do not know if it causes more severe illness. That is something that we will be learning about. And it's possible that the increase in the number of young people being affected may be due to, you know, the fact that younger people are less likely to be vaccinated. It also may be that it's possible that it's slightly more transmissible. We don't know the answer to that yet. So there are a lot of questions, and within the coming weeks, we certainly will have a lot more information.
All right, we'll continue to watch this. Dr. Ben Springgate, thank you so much for joining us.
Great to be with you.
All right, guys, we will continue to follow the latest developments on this Omicron variant and its impact in our area and beyond. So stay with us for updates throughout the day on air and on our app and at WWLTV.com.